Worried about getting a colonoscopy? Let me walk you through the whole process and explain to you exactly what is involved. This simple procedure could save your life, and I'm going to explain to you why it's not as daunting as you think. Hello, my name is Rajeev Peravali. I'm a general and colorectal surgeon based in Birmingham and the surrounding areas. I work at Midlands Colorectal. One of the many things I do is colonoscopy. Colonoscopies are used to screen for and diagnose a number of conditions. Let me demystify this procedure for you. What is a colonoscopy and why is it important for you? This is why. Let's begin with a very fundamental question. What is a colonoscopy? Colonoscopy is a relatively simple test where I place a camera through your back passage to examine the inside of your colon. The procedure is very safe. Initially, you will have some bowel prep. This is strong laxatives that you'll have prior to coming to see me in the hospital. And then most people choose to have sedation. This is intravenous sedation, where I put a small needle into your arm and give you some sedation. The sedation tends to be morphine-based, and this reduces the anxiety and pain associated with the procedure. Once you've been sedated, you'll be on your side and I'll insert the camera through your back passage into your rectum and colon. I will then slowly and surely look through the whole of the lining of your bowel, and my purpose here is to look for anything that might be causing your symptoms. It also enables me to take out any polyps at the time of the procedure. The great thing about colonoscopy and removing polyps is that these polyps can sometimes go on to develop into cancer, and that is what's fantastic about a colonoscopy. We can prevent cancers before they even develop. If you are preparing for a colonoscopy, listen to this. One of the most common concerns that a patient has is the bowel prep prior to colonoscopy. Different hospitals use different preparations, so this can vary slightly. Put very basically, in the few days prior to your colonoscopy, we recommend a low residue diet. And the day before your colonoscopy, we say that you should not eat any solid foods the day before. You are encouraged to drink lots of water. Your bowel prep then starts at a certain time. Generally, this is a powdered form that you make up into a liquid, and you drink approximately 2 liters of this. You do need to follow the instructions very carefully. The better you follow the instructions, the cleaner your bowel and the easier the test and the better the test. So you do need to be very close to a toilet when you're using this bowel prep, and this is usually in the comfort of your own home. Specific instructions do vary depending upon the specific preparation used, so do follow the very detailed instructions you will be given. Anxious about your colonoscopy day? This is for you. So let me walk you through what happens on the day of your colonoscopy. Having had your bowel prep the day before, you come into hospital. You'll be greeted by the endoscopy team and probably the endoscopy lead nurse. They will take you into a room where they will admit you. This means taking a brief history, making sure you've stopped the right medications, you've taken your bowel prep appropriately, whether you're happy to have sedation, whether you've got someone to pick you up. They'll ask you all of these questions. Following this, you will finish the admissions process. Then your specialist, usually me, will come and talk to you and confirm the consent. I will have spoken to you about the procedure already at the time of our consultation, and this really is to confirm that you have no further questions and that you're happy to proceed. Following this, the team will get you changed into a gown and often what we call dignity shorts. These are really interesting shorts with holes in the back where I'll be able to place the camera through into your back passage. You'll then come into the endoscopy room. This is where the procedure takes place. What I do then is put the little needle or Venflon into your arm. This enables me to administer the sedation. And the purpose of this is to reduce the pain from the procedure and reduce the anxiety people often have when they do go through this procedure. We'll then get you onto your back. The team will then check some blood pressure and various observations, and we'll get you into position, which is usually onto your side. I will then administer the sedation through the Venflon that I've inserted previously and then proceed to the test. The test, as I've said before, involves inserting the camera through your back passage. It can be uncomfortable as we go through the bowel and try and traverse the bends of the bowel, but usually most people tolerate this really well. Now, if it is particularly uncomfortable, we can offer you what's called gas and air. This further helps with the pain and symptoms that people experience during the procedure. Following the procedure, we obviously clean you up and then move you to the recovery area. You'll spend 30 to 40 minutes in this area and there will be a nurse looking after you. You'll also get some food because you haven't eaten for 24 hours. So this will be the best sandwich or toast that you've ever had. I normally come and talk to you as well and give you the report. By this time, the sedation is worn off, so you understand what's going on. So you find out the results straight away. So the whole process takes about an hour and the procedure itself takes about half an hour. Are colon polyps dangerous? So when you go for a colonoscopy, often we find polyps. What do we do with those polyps? Small polyps can be removed at the time of the procedure, but larger polyps may require a further procedure. It's really important to remove them because they can grow bigger, they can cause symptoms, and they can develop into cancers. The first thing is, if we're concerned that the polyp may be something more sinister like a cancer, we would biopsy and we would send these to the lab urgently. Further management will be based depending on the results of these biopsies. Now, if the biopsies are benign and it is just a polyp, these can be removed often endoscopically or through the colonoscopy. This is done usually on a special list by an experienced interventional endoscopist. The recovery process after colonoscopy. Listen to this. So you'll be in the recovery room being looked after by an endoscopy nurse. I will then come and talk to you. What happens after that will be determined by what we've found. I usually will see you in clinic to explain things a little bit further because often the drugs are still in your system and you may not fully understand or fully recall the questions that you might have. A few things though to understand and be aware of after your colonoscopy, particularly if you've had sedation. You cannot drive for 24 hours after the procedure. This is really important and you must make plans for work in order to accommodate this. It's really important to be aware that you cannot make any legally binding decisions or sign contracts again for 24 hours. Following the colonoscopy, you'll come and see me in clinic, usually a week or two later. I'll have the biopsy results if I've taken any biopsies and we'll plan further management. In the immediate period following a colonoscopy, you will obviously feel bloated. This is because I've inserted a lot of gas during the procedure and you will need to release it. It will come out, so don't be afraid to pass the wind because it's fresh air and it's the only time you'll be allowed to pass wind and actually be congratulated for it. If you have bowel symptoms or feel that you need a colonoscopy, please book a consultation with me. My name is Rajeev Peravali. I'm a consultant general colorectal surgeon in and around the West Midlands at Midlands Colorectal.